Breast is best, and that's just my opinion, and that sounds a little bit inappropriate thing to say if you haven't looked at the title of this video. If you've just given birth to your newborn, congratulations, or if you're expecting and you have Crohn's and colitis, you may be wondering if you should breastfeed when on IBD medication. Well, this is what I'll be talking about in this video, so stay tuned to find out all about breastfeeding and taking medications when you have Crohn's disease and ulcerative colitis. Welcome back to my channel, the only place for Crohn's and colitis tips, tricks and information. So make sure you subscribe to my channel and hit the bell to be notified every time I post a video. And if you want to join an exclusive community of people who receive tips and tricks on living with Crohn's and colitis, make sure you sign up to my newsletter by visiting the link in the description box below. Now, pregnancy and fertility have always interested me, and it's one of the reasons why I went on to do my master's in reproductive medicine and worked in the pregnancy and fertility field for a few years before becoming a radiographer. But what's even more interesting is pregnancy and fertility when living with chronic conditions such as Crohn's and colitis. So let's just get straight into things. There are so many benefits of breastfeeding your child, and I totally understand that everyone is different and not only has different opinions on this topic, but will also go through different circumstances which will determine if they can or cannot breastfeed their child. So breastfeeding your child can help in reducing the risk of them obtaining infections, because what you'll be doing is passing on your antibodies that you've acquired, which will help protect your child. Now, breast milk is very nutritious and has all the nutrients your child needs to grow and develop. And it's a great way of mother and child to bond with each other. And most of all, it is free, so you don't have to spend money on formula as you'll be making it naturally. Now, the World Health Organization actually recommends that mothers should breastfeed until the child is about 6 months old, and then to continue to partially breastfeed until the child is 2 years old. But what do you do if you have Crohn's and colitis and are on medication? Should you even breastfeed? Well, this will all be dependent on the type of medications you are on, and you need to discuss this with your doctor to make sure it is safe to do so. If you are not sure what drugs I use to treat Crohn's and colitis, then make sure you check out this video where I'll explain exactly what each drug is and what it does in the body. Just a little note here, if you do have any concerns over if you should breastfeed when on medication, please discuss these with your doctor and IBD team. Now, if you are on the biological drug infliximab, the majority of the research suggests that it doesn't pass to breast milk, but one study did find small amounts in breast milk, so the data is a little bit contradictory at the moment. And the same thing goes for adalimumab. Despite this, many doctors say women shouldn't be discouraged to breastfeed if taking these medications, and for vedolizumab, it is not yet known if it passes into breast milk. If you are on immunosuppressants like azathioprine and mercaptopurine, then these can pass through into breast milk, but there is no evidence to suggest that they do cause harm to your baby. Aminosalicylates are also passed into breast milk, but in very low concentrations and pose little risk to your child if you choose to breastfeed when on them. However, some babies can have a reaction to the trace amounts of aminosalicylates, which can cause diarrhea, so it's important that you carefully monitor them, but the diarrhea should stop normally or if you stop the drug or switch to bottle feeding. But then again, it's also important to discuss this with your doctor and to make sure your baby is actually checked out by your doctor if you are worried about this. Now, with steroids, they also do appear in breast milk, but also in very low concentrations. And in general, they are considered safe to take when breastfeeding, but this will also depend on the dosage that you're on. And so breastfeeding may not be advised if you are on high dose steroids. If you're on the following medications such as tacrolimus, cyclosporin, mycophenolate, mofetil, metronidazole, or methotrexate, then you shouldn't breastfeed because these do pass into breast milk. So that is a very brief description of which medications you can and can't have when breastfeeding, but as I said earlier, it's really important to discuss all this with your doctor and the IBD team. Now make sure you check out these videos for more useful tips, tricks and information for Crohn's and colitis. Hit that subscribe button and the bell to be notified every time I post a video, as well as leaving a like and a comment if you enjoyed this and found it useful. And I can't wait to see you in the next episode.